Eva, we are back again talking about another exciting topical treatment for men and women for hair loss. And the interesting part about minoxidil, which is our topic today, is that we can now utilize minoxidil topically as well as orally. And in many cases, combining the two, and then also most cases, we're seeing very good absorption rates, very good efficacy, and very little side effects. The Cleveland Clinic even, set out in 2022 to give their blessing to minoxidil, and they are offering strong evidence that the treatment with minoxidil, oral and topical, is such a great opportunity for those with hair loss, men and women. So tell me how you are utilizing minoxidil treatment in your clinic in the UK.
So we use minoxidil in clinic for treating male and female pattern hair loss predominantly. That's what it was originally developed for. And we find it extremely effective. We get very, very good results. We would use a 2% solution on ladies under the age of 25, 30, and 5% over that age, and 5% for guys. And just as you say, we get very, very few side effects. Occasionally, it can irritate the scalp. Generally, I tend to find people are putting too much on. They get a little bit over enthusiastic. You don't need very much. Some people are worried about the side effect of it might lower blood pressure or increase heart rate. Topically, we tend to find that 90% of it sits in the follicle. It doesn't go anywhere else. So it's incredibly well tolerated. And I've never had any kind of doctor tell me not to use it. And over the past 20 years, I have corresponded with many, including heart specialists, oncologists, general practitioners. Most people topically really don't have a problem with it being used. People panic when they read things about minoxidil on the internet, or my hair's going to drop out.
Yes.
Again, I don't tend to find that. I do find that some people will get an initial shed. It's not massive. It lasts for 6 to 8 weeks. And all it's doing is it's moving that miniaturize, that hair that's affected by the androgenetic alopecia, from the growing to the resting to the shedding phase more quickly, to get it back in the growing phase to keep it there. And I find that, the amount of people that really have a problem is minimal, really, really minimal. And we get great results with it. And we do use it orally. I'm not a prescriber, so I can't prescribe it. It's a prescription-only drug over here in the UK. And we would tend to use it in more resistant types of hair loss problems. It can orally be a little bit more unstable because it's systemic, it's in the blood, it's not sort of just sitting in the follicle. And that's where it's not maybe as widely used, because people with things like blood pressure issues, topically they'll tolerate it really well, but not always orally. But we do use it for things beyond male and female pattern. We use it in treating alopecia areata. We use it in frontal fibrosing alopecia. There's lots of uses for it in different ways. And for me, it's a really good treatment that gets brilliant results. We've done an analysis of patients, and about 70% of our patients get a really positive result with topical minoxidil.
Ah, brilliant. Very good. Well, and we also find that we are seeing a lot of our female clients prefer many times the oral medication over the topical, because they always want less mess in their hair, right? And so we are fortunate enough to be able to prescribe, because we're under the direction of a medical physician specialist. And so we are finding that low doses of oral minoxidil, even as low as 0.625 milligrams, will help many men and women without the unwanted hair growth in places that women especially do not want, such as their chin, their forehead, and their cheeks, right? So we are having great success with that. And speaking of the irritation on the scalp, we do see that occasionally, and we are pretty aggressive. So we go all the way up to an 8% minoxidil. And I will say that we add tretinoin to a lot of our minoxidil compound treatments, but we're very cautious when we're utilizing a stronger percentage, such as 8%. And right, the jury's out. I mean, the old adage, well, if 5% works, let's use 10%, we've seen in clinical support that there's very few cases that we do see greater improvement with a greater percentage. However, for those tough cases with scarring alopecia, as well as we treat quite a few women and men after chemotherapy. So chemotherapy-induced alopecia, the topical works extremely well. And the tretinoin obviously helps exfoliate that scalp. So it works great. And so I do think, to your point, both medications, even though they are synthetic drugs, can be used within reason with terrific results.
Yeah. And I think that spending the time explaining to your patient how they work, what to expect, and dispelling some of those myths that are all over the internet is invaluable, because I see lots of people who are resistant to it because they've been given misinformation on the internet about it affecting hormonal performance, for example, which we know it doesn't. So that's where we as trichologists, I think, have the time to be able to spend with our patients to really inform them and show them how to use things to get the best out of it.
Oh, 100%. But, we, I think, would be falling short and not supporting our listeners if we didn't share with them about a natural topical that you have actually developed called Tricoactive Plus. That is amazing solution for that stimulation, bringing into play a lot of natural hair growth and hair loss treatments, all in a very safe, effective, non-synthetic, non-medical topical. So tell us a little bit about Tricoactive Plus.
So Tricoactive Plus is a topical lotion. It's applied to the scalp. It absorbs super quickly. It doesn't really affect the hair at all. And it works on the same principle as Minoxidil, but it doesn't contain Minoxidil. So Minoxidil is a pharmaceutical. It's a drug. We use a natural vasodilator. It's called methyl nicotinate, and it's very effective. And we use a very, very tiny amount of very pure alcohol. And you need that to get what we've got to carry into the depths of the hair follicle, which is where it does its job. And Minoxidil vasodilates and takes a whole cascade of things into the follicle with it. What we do with Tricoactive is we provide a whole cascade of very natural things to be put into the follicle. So we use hop. Hop is what we use to make beer from. It's a plant, and it's absolutely brilliant at providing natural estrogen into the follicle. As we know, estrogen makes the hair luscious and thick, and it's also a natural stimulator to keep the hair in the growing phase for longer, so it reduces that shedding. We have rosemary in there. Rosemary's in there. We've spoken about it before to support blood flow, and it's a natural antioxidant on the scalp as well. We've got clover. Clover has got estradiol and esterone in it, and they're really, really positive in terms of keeping the hair growth on the head and increasing diameter. We've got nettle. Nettle, again, is a natural DHT blocker, but it helps the strength of the hair. It's got silicon and sulfur in there. It's got brilliant antioxidants, vitamin A, vitamin C, vitamin E. And then we've got some sandalwood as well. And sandalwood's great at preventing things like seborrheic dermatitis. So we spent a long time looking at what nature's given us and how we could make it mimic what minoxidil does, but without any of the downside of minoxidil. And that's how we got to Tricoactive. And I developed it in conjunction with a colleague of mine, Dr. Mike Ryan. He's called the Dubai Hair Doctor. That's where Mike practices. And we did a lot of testing before we launched it. Mike uses it himself. And we use it now alongside things like minoxidil. So, sometimes people are using minoxidil twice a day. They could maybe use it once a day and use the Tricoactive. You can use the Tricoactive to maintain that hair diameter boost between PRP treatments.
Mm-hmm.
You can use it in hair shedding, telogen effluvium, whilst you're waiting for all the underlying causes, things like nutrition, nutrient deficiencies to be corrected. The hop helps that hair to stop shedding and keeps it on the head, which reduces the anxiety that goes with that condition. So it's brilliant to use in conditions like that. And again, I've used it in things like FFA, alopecia areata. It's very good at stimulating and distracting the immune system. So really proud of it. And the feedback we've had has been amazing. People are loving it.
Well, and the great thing is fortunate for our clinic in the United States, we now are able to supply the US market with that product as well. So we hope that we'll be able to get a lot more Tricoactives Plus out there so people can then start sharing their feedback as well, right? I mean, that's the only way that you and I learn is through clinical data, clinical support groups, clinical trials, and many of these trials, just as you discussed earlier, right, with utilizing some of your patients and giving them different treatments. And then after so many months, we check back in, right? We're constantly doing this with new products. So it is, it's the only way that I think you and I both feel 100% confident and comfortable sharing that something is going to work, or if there is any indication of what we need to do.
And a point in question only this week, I had a patient contact me. I've been treating her for hair shedding. She's got dietary issues and she was taking the Trico Extra supplement. And she is quite a complicated medical case and needs to lose weight fairly urgently. So she saw a private GP who specializes in weight management, and he's advised that she takes the Monjaro to help her. But he said to her, you're going to need a good supplement. And she pulled the Trico Extra out of her handbag and he read it. And he said, where did you get this from? And she said, oh, my trichologist. Why? And he said, it's a brilliant formulation. Do you mind if I take a picture of it? And I can advise other patients that this is exactly the sort of supplement they should take if they're taking something like Monjaro. And for me, that was just brilliant feedback because it has won awards and you do forget and you do take it for granted because you use it every day in clinic. So it's always lovely to get that kind of feedback when you're not looking for it, you're not expecting it. And it comes from a medical expert. You think, trichology's in there. We do know what we're doing. And it's so great to be able to help everybody.
Oh, that's wonderful. Congratulations. I know that made your day when you heard
Absolutely.
that. It certainly would have mine, right? I mean, we're constantly looking for just a nod, right? From westernized medicine that says, oh, yes, you do know what you're talking about. Oh, yes, this does work. So that's wonderful. Well, Eva, it was great chatting with you today, and I loved our topic on minoxidil. And so we will look forward to taking up another exciting topic on hair loss very soon. So you have a wonderful day. Take care.
And you too, take care. Speak soon. Lots of love to everybody.
Bye-bye.
Bye.